Generally, for pregnant patients in particular, we're trying to really make sure they get adequate nutrition for both their health and the baby's health. We want to make sure they're getting prenatal counseling and prenatal vitamins. We want to make sure they're able to absorb, especially in patients who have a short small bowel from previous surgeries. In general, we're making sure that they have adequate both macronutrients and micronutrients. And really it's engaging the patients so that they don't give up on us giving them nutritional advice, because they'll seek it on the internet and there's a lot of crazy stuff out there. There's a lot of unproven stuff. One of the downsides to the field is, unlike medications, which the FDA regulates, there are very strict standards for randomized controlled trials and having good evidence of control of inflammation with centrally read endoscopy. With nutrition, we have nutraceuticals. It's sort of the Wild West. Anyone can do a tiny study with 10 patients without objective markers and make claims, and that's commonly done. And patients don't really understand the difference between a 15-patient study where patients felt better and a rigorous 300-patient study with centrally read endoscopy as the outcome. So nutrition is a difficult area for us because we haven't been able to engage with patients. It really helps to have an embedded registered dietitian in your practice. That's been a big component for us at Michigan, to counsel patients. And I think the key is to have that as part of your practice, to have it available to patients. Some patients will have reimbursement for their insurance, many won't, and will have to choose to self-pay if they're interested. But many patients are very interested and very motivated and will be willing to do that. And by engaging them on that level, they're not spending that money on supplements that they find on the internet, and we'd much rather them get quality evidence-based advice from a registered dietitian than finding whatever they might find in the Wild West or the internet. I think the key is to engage your patients about their nutrition questions. Ask them if they have questions about food or nutrition. You'll get a lot more than the patient is telling you or volunteering. And once you know their questions and you can engage them, you can at least steer them to evidence-based approaches, keep them from restricting their diet, and ensure adequate nutrition so they can have good mucosal healing of their bowels.